Right now, somewhere in your kitchen, is probably a small glass jar you haven't opened in months. Inside are dried flower buds, dark brown and about the size of a fingernail. You bought them for a holiday ham or a pot of mulled cider, and they have been sitting there quietly ever since. Here's what almost no one has told you. In that jar is one of the most studied natural compounds in modern medicine. The central molecule in it has been the subject of over 1,300 peer-reviewed scientific papers. Researchers have pitted it against inflammation, against blood sugar, against liver damage, against bacteria that cause stomach ulcers, and against the bone loss that robs millions of older adults of their independence every single year. And the recommended amount is not one capsule. It's not a supplement subscription. That's 2 cloves every day. Second, that's all there is to it. But before you go grab that jar, I need you to understand something, because there is a right way and a wrong way to do this, and the wrong way wastes most of the benefit. There is also a set of people watching this video that should not start taking cloves on a daily basis without calling their doctor first. And I am going to tell you exactly who you are near the end. If you're on a blood thinner, that's you too, and I need you to stay with me until we get there. I am Dr. John. I am board certified in internal medicine, specializing in nutritional biochemistry and healthy aging. Over the course of 28 years in clinical practice, I have sat across from more than 40,000 patients. Most of them would come in with a bag of supplements, and they were spending $200 a month on it. Most of them had no idea one of the most evidence-based anti-inflammatory foods on the planet was already sitting in their spice cabinet, costing them roughly a cent a day. Before we go any further, do me one small thing. Drop a comment below, now, with your age and the state or country you're watching from. That is all. I read these and we respond with personalized suggestions, so don't hold back. It also helps me get a sense of who's out there, so I can make these videos more useful for you specifically. Today, I am going to share with you 7 documented benefits of taking 2 cloves daily after the age of 50. But I need you here for all 7, because number 6 is the one that shocks people. It has nothing to do with blood sugar, nothing to do with digestion, and everything to do with your heart and your brain, in a way your doctor has never had time to explain in your 15-minute appointment. I started doing this because of the number 6. This will make everything else make sense. So let me begin with what is actually inside a clove. A clove is the dried, unopened flower bud of a tree called Syzygium aromaticum, native to a small group of islands in Indonesia. What is extraordinary is the density of what is packed inside of something that small. Essential oil can comprise as much as 15 to 20% of the weight of a clove bud. About 70 to 90% of the essential oil consists of a single molecule called eugenol. Eugenol is the cause of that particular smell in your dentist's office. It's been around for over a century because it numbs tissue and kills bacteria at the same time, so dentists have been using it. But eugenol does much more than that in the body, and I will show you. Cloves also contain beta-caryophyllene, a compound that calms immune cells without affecting the mind in any way whatsoever. They have quercetin and K-ampherol, 2 flavonoids that have been heavily studied for their protective effects on blood vessels. And they have manganese, a mineral your mitochondria absolutely need to protect themselves from oxidative damage. Here's the number that gives cloves context. Ground cloves have about 290,000 ORAC units per 100 grams of the spice. Blueberries, which you've heard called a superfood your whole adult life, score under 5,000. Cloves are not a little better than blueberries. They're on an entirely different level. Nothing else in the common food supply has ever tested as high. And this is why it's 50 and not before that things matter. Benefit 1. Cloves can quieten that silent inflammation that is aging you from within. Researchers have a name for the way our immune system changes with age. That's called inflammaging. It is not the passing, useful inflammation of a cut finger that heals and passes away. It is a low-level, constant, smoldering activation of the immune system that never fully resolves. It is in your blood. It gets into your joints. It's part of your brain tissue. And it quietly drives cardiovascular disease, type 2 diabetes, arthritis, cognitive decline, and most cancers. We measure it by a blood marker we call C-reactive protein, or CRP. CRP usually is less than 1 milligram per liter in healthy young adults. It increases steadily with every decade of life, and high CRP is independently associated with increased risk of heart attack, stroke, and all-cause mortality. This is the truth that very few outside of medicine ever explain. There isn't one switch that controls inflammation. One is controlled by a master switch in your cells, called NF-kappa B. Think of it like the main breaker box in the basement of a house. Flipping that breaker on turns on dozens of separate circuits at once. The genes it turns on are the genes that turn out inflammatory messengers, like TNF-alpha, interleukin-1 beta, and interleukin-6. It's these messengers that actually cause the damage. Published reviews, including a detailed assessment of Eugenol's anti-inflammatory profile, have found that Eugenol blocks NF-kappa B activation and reduces the production of all three of those inflammatory messengers in lab and animal models. It turns the breaker down in plain English. Not away, down, gently, steadily, day by day. I want to be honest with you about the limits here, because I will never oversell something to you. Much of the research on NF-kappa B has been done in the laboratory and in animals, not in large numbers of humans. The evidence for the mechanism predates the human evidence. But the direction of the findings has been strikingly consistent across dozens of independent research groups. And this is a food, not a drug. Stick around, because the next one has real human trial data behind it. Second advantage. Cloves have been shown to reduce blood sugar in real live people. According to the CDC, about 29% of American adults 65 and older are diagnosed with diabetes, and about half of that same age group has prediabetes. Combine those statistics and you are talking about 3 of 4 older Americans with some quantifiable degree of blood sugar dysregulation. Most of them don't know because they're totally silent those first years. And that's when cloves get really interesting. In a clinical study through United States Department of Agriculture research, 36 people with type 2 diabetes were given capsules containing 1, 2, or 3 grams of clove powder daily for 30 days. All 3 groups saw reductions in glucose, and researchers also recorded decreases in triglycerides, total cholesterol, and LDL cholesterol. The last part is very important because blood sugar problems and problems with cholesterol are almost never alone in older adults. Another pilot study, published in a peer-reviewed complementary medicine journal in 2019, used a concentrated water-soluble clove extract, only 250 milligrams once a day for 30 days. In the group whose fasting glucose was already in the pre-diabetic range, post-meal glucose dropped about 27%, and pre-meal glucose dropped about 12% by day 30. And the laboratory part of that same study showed why. The compounds in cloves increased glucose absorption into muscle cells, decreased the release of sugar from the liver into the bloodstream, and inhibited the enzymes that convert dietary starch into sugar. That last mechanism is the general strategy used by a prescription diabetes drug called acarbose. Now, I am going to tell you something, which the other videos on this topic will not tell you, and I want you to trust me for that. 2 whole cloves weigh about 2 or 3/10 of a gram. That's less than the 1 to 3 grams used in clinical trials. So if you are told that the studied diabetes dose is the same as 2 whole cloves, then that is not right. 2 whole cloves is a real meaningful daily food level dose of Eugenol. Compounds are what takes months of consistency. But if blood sugar is your specific goal, I'll show you a ground clove method later in this video that gets you much closer to the amounts actually studied. And please listen very carefully. Cloves might increase the effects of metformin, insulin, or any glucose-lowering drugs you are taking. But that does not mean we should shy away. That's why your doctor needs to know so no one is surprised by a low reading. Benefit number 3. Cloves may help protect the hardest working organ you never think about. Everything runs through your liver. Every pill you take, every glass of wine you drink, every environmental chemical, every metabolic byproduct your body makes. And over 60, the liver's processing capacity decreases while the workload generally increases, since most adults over 60 are taking more medications than they were at 40. And to make matters worse, fatty liver disease currently affects nearly 4 in 10 adults in the United States between the ages of 60 and 74. 40%. It is the most common liver condition in the developed world. It has virtually no symptoms for years, and it was written off for decades as just getting older or just a few extra pounds. Eugenol kicks off a protective pathway inside your cells called number 2. Here's the analogy I give to patients. Number for 2 is not a fire extinguisher. It's the switch that tells the building to make its own fire extinguishers. When activated, your liver cells produce more of their own antioxidant enzymes, including glutathione, superoxide dismutase, and catalase. These are the molecules that neutralize the reactive oxygen species that your liver produces every time it processes something toxic. Published animal research has shown that Eugenol supplementation reduced elevations in ALT and AST, the two liver enzymes your doctor checks on routine blood work to detect liver cell damage. The protective effect seemed to run right through that number forte-2 pathway. I need to be precise here. This is animal and cell research, not human trials. But if you're over 60 and on 3, 4, or 5 medications a day, it's a sensible, low-risk thing to do to support your liver's own antioxidant machinery with a spice. But before we start, I want to make sure you understand something, because it's the most important sentence in this whole video. Nothing I'm describing is a replacement for meds. Nothing at all. Cloves do not replace your blood pressure pill, your statin, or your diabetes medication. What they are is a little daily evidence-based adjunct to good medical care. If someone tells you to stop a prescription and take a spice instead, they're dangerous and you should stop watching them. 4. Advantage. Cloves counteract the digestive deterioration that most people take for granted. Digestion does change as you get older, and it's not in your head. Stomach acid production decreases, reducing your ability to digest protein and absorb vitamin B12 and iron. Decrease in pancreatic enzyme output. This slows down the gut, which is why chronic constipation affects 1/4 to 1/3 of adults over the age of 65. And every decade, the diversity of your gut microbiome, that community of trillions of organisms that modulate immunity and mood, shrinks. Cloves have been used as a digestive remedy in almost every traditional medicine system on Earth, and we now understand how. Eugenol has antispasmodic properties, relaxing the involuntary muscle contractions of an irritated gut wall. That's what gets rid of cramps and the trapped, bloated feeling after eating. Cloves are also known to have antimicrobial activity. A 2023 study in the journal Molecules examined the impact of clove essential oil on antibiotic-resistant strains of Helicobacter pylori, a bacterium that colonizes the stomach lining and is strongly linked to peptic ulcers and stomach cancer in older adults. In laboratory tests, it damaged bacterial cell membranes and disrupted their protective biofilms. That is a test tube, not a person, and I want you to keep it as such. Cloves don't cure an H. pylori infection. If you have one, you need proper antibiotic therapy from your doctor. But it does tell us something real about the environment cloves create in the upper digestive tract. Hold on to me, because the next two are the ones that determine if you're still driving yourself to the grocery store at 85. No. 5. Advantage. Cloves support bone and joint tissue just as both begin to fail. Osteoporosis affects about 1 in 5 women and 1 in 20 men over 50 in the United States. And many more have osteopenia, the earlier stage. I want you to understand what these numbers truly mean in a human life. A broken bone is not a hip fracture at 78. Often, it means the end of living independently. It's the thing that transports a person out of their own home and puts them in a facility. Bone is not static. It's being torn down and rebuilt every day of your life by 2 competing crews. Osteoblasts build osteoclasts' resorption. About even before 50, the crews are. After 50, especially after menopause, the demolition crew starts outworking the construction crew, and you lose density year after year, silently, no symptom whatsoever, until something snaps. Administration of Eugenol has been shown to help preserve bone metabolic markers and decrease bone deterioration in animal studies, including those performed in overectomized rats, a model used for postmenopausal bone loss. Separate lab work shows Eugenol appears to help the bone-building cells, but inhibit the bone-resorbing cells. That double direction is basically what osteoporosis meds are supposed to do, but via entirely different molecular pathways and at a vastly greater strength. On the joint side, osteoarthritis is driven substantially by inflammatory enzymes that chew through cartilage. And those enzymes are switched on by the very NF-kappa B pathway we discussed in Benefit 1. Reducing the inflammatory tone in joint tissue is a plausible, mechanistically sound way to support cartilage in the long term. One honest correction, because I've seen this claim repeated every place. You might hear that 2 whole cloves give you 30% of your daily manganese. They don't. 2 full cloves is closer, 5 to 8%. A half teaspoon of ground cloves, in contrast, gets you into the 25 to 30% range. And that's a real contribution. And I'm going to show you exactly how you use that in a second. Benefit No. 6. This is the one I promised you, and this is why I take cloves myself. Periodontal disease. And I need you to stay with me because this is not a dental video, this is a brain and heart video. About 2/3 of adults over 65 have periodontal disease, and most don't even know it. Gums slightly puffy, bleed a little when you brush, recede a bit, just written off as getting old. That's been the cycle of research for the last 15 years. The bacteria that cause gum disease don't stay in your mouth. Your gums are very well supplied with blood vessels. Chronic gum infection leaves a permanent open doorway into your bloodstream. One particular bacterium, Porphyromonas gingivalis, has been found in the arterial plaque of heart disease patients and in the brain tissue of people who died with Alzheimer's disease. Periodontal disease has been linked to cardiovascular events and cognitive decline in several large studies. Association does not prove causation. Researchers say it's not yet clear if the gum bacteria are causing the damage or just hitched a ride with it. I will not overstate anything to you. But here is what is not disputed. Eugenol has been used for more than a century in clinical dentistry due to its antibacterial property in the oral cavity. Zinc oxide eugenol is a widely known dental material. Chewing 2 whole cloves slowly releases eugenol directly onto your gum tissue and oral mucosa, where its antimicrobial activity is most clinically established. Cloves have the longest track record and the most powerful in the mouth of all the benefits in this video. And the mouth may be an underappreciated path to your heart and brain. That connection is why I do this every day. Benefit number 7. Early days for research on the aging brain. Eugenol is capable of penetrating into brain tissue and has demonstrated neuroprotective effects in animal models, reducing oxidative damage in neurons, and in some studies, inhibiting acetylcholinesterase, the enzyme that breaks down acetylcholine. Interestingly, the neurotransmitter that is central to memory, acetylcholine, is the same enzyme that the main class of Alzheimer's drugs available today works by inhibiting. Now, I want to be very careful and very honest with you. This is research on animals and in laboratories. There is no human trial that shows cloves prevent dementia. If anyone tells you otherwise, they are lying to you, and I will not be that person. What I can tell you is that reducing systemic inflammation and oxidative stress is one of the few things most people agree on in terms of protecting the aging brain. And cloves are part of both. Now I'm going to tell you how to actually take them, because the method changes how much you absorb. Method 1, the most bioavailable. Chew 2 whole cloves slowly for 1 to 2 minutes and swallow. Chewing it breaks down the cell walls, releasing the oil directly into the tissues of your mouth, where it is quickly absorbed. This is also how you get the oral health benefits from number 6. The taste is strong and a bit numbing to the tongue. If 1 is not enough at first, try 2 for a week. Best time is first thing in the morning, 10 to 15 minutes before breakfast. Method 2, and the kindest. Clove, water. Take 2 whole cloves in a cup of water at room temperature before going to bed. Let them soak overnight for at least 8 hours. Remove them in the morning and drink the water on an empty stomach. It's easy drinking and lightly scented. Do not boil hard. High heat destroys the fragile phenolic compounds. A gentle warm steep is okay. And the one for blood sugar. Method 3. Grind cloves in the food. Here's how you go about the doses used in the real clinical trials. That's about 1 gram of ground cloves. Add cinnamon and stir into oatmeal. Blend in a smoothie. Mix it with warm milk, turmeric, and a pinch of black pepper. Add it to the soup after cooking, not during, because heat above about 180 degrees Celsius breaks down eugenol. Method 4, for digestion only. Clove tea, 15 to 20 minutes prior to your biggest meal. Crack 2 cloves with the back of a spoon and pour over just boiling water. Steep for 5 to 7 minutes, strain, and sip slowly. Now the safety section and I need you to actually listen to this part and not skip it. If you take blood thinners, such as warfarin, clopidogrel, or apixaban, eugenol has a mild anticoagulant effect that may complement your medication. Do not start taking cloves on a daily basis without consulting your doctor first. so he can keep a watch on your levels. If you are due to have surgery or dental extraction, stop taking cloves at least 2 weeks before. If you are on diabetes medicine, check your glucose more often for the first couple of weeks and tell your doctor. If you have liver disease, check with your doctor first. And never, never swallow concentrated clove oil. Clove oil is different from clove. The concentrated oil, when ingested, has caused serious liver injury and in children can be life-threatening. Store it out of reach. We are talking about the entire spice only. If you are pregnant, have active stomach ulcers, or if cloves worsen your reflux, this is not for you. And to put the dose in perspective, international food safety agencies define an acceptable daily intake for eugenol of around 2.5 milligrams per kilogram of body weight. 2 whole cloves will comfortably put the average adult right in that range. This is a practice of food, not pharmaceuticals. So here's what I want you to do tonight. One thing, get to your kitchen. Bring me that jar, open it, smell it. If the scent is weak and dusty, they are old and most of the oil has evaporated and you need fresh ones. If it smells sharp and warm and hits you right away, they are good. Then put 2 cloves in a cup of water and put it on the counter, next to your coffee maker where you will see it in the morning. That's it. That is the entire assignment. 30 seconds, no money, no appointment. Here is what I have learned in 28 years of practice. It is almost never those who did something dramatic who remain independent well into their late 80s. They're the ones who did a little something every day for 15 years. Health after 50 is not the work of one decision. It is made in the consistent repetition of little things that nobody cheers you for. You've worked too hard for the life you've had. Your independence, your ability to get in your own automobile, to lift your own grandchild, to sleep in your own bed in your own home. Who's going to take care of that for you? It can't be protected for you by a 15-minute appointment. It is guarded by knowledge. And now you know something about that jar in your kitchen you didn't know 20 minutes ago. Now you know why. Do one thing for me before you go. Right now, share this video on Facebook and tag one person you love who is over 50. A husband, a wife, a brother, a sister, a neighbor, an old friend you haven't called in a while. Your share will cause someone in that person's life to have a conversation with their doctor, and neither of you will ever know it. Just do. And if you have not subscribed yet, please do subscribe right now. We're working toward 500,000 subscribers because that's the number that triggers the algorithm to put this information in front of every older adult looking for it tonight. Then drop a comment and tell me which of these 7 benefits meant the most to you and if your doctor has ever once mentioned cloves to you. I want to know so badly. This video is for educational and informational purposes only. Information in this channel is not intended to provide personal medical advice, diagnosis, or treatment. Always check with your physician, pharmacist, or other healthcare professional before making any changes to your diet, your supplements, or your medications, especially if you take blood thinners or diabetes medication. I'm Dr. John. Thanks for watching, and I'll see you in the next video. There is one thing I did not intentionally include in this video. There is a second spice, even more common than cloves, in the same cabinet. When combined with cloves, the two of them influence blood sugar in completely different and complementary ways. Together, they seem to have a greater effect than either alone. But there is a particular way to pair them, and a particular mistake most people make that wipes out all the benefit. That is covered in the next video.